Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the information of hypothyroidism. In today's video program, let's have a glimpse of hyperthyroidism. The word hyperthyroidism means excessive thyroid hormone levels in the body, where it's a increased thyroid hormone, that is increased T3 and increased T4. The word hyper means high and the word hypo means low. Now let's have a quick review of thyroid hormone formation. Hypothalamus secretes thyrotropin hormone, anterior pituitary secretes thyroid stimulating hormone, thyroid gland secretes T3 and T4, where the thyroid stimulating hormone will join the receptor. This thyroid gland is made up of follicular cells. This is a follicular cells structure. This is a lumini. This is the receptor. Now we have exposed bit more. So these are the individual follicular cells. You can see the receptor over here, where this is TSH. Now TSH binds to this and gets into the cell and stimulates the thyroglobulin, as well as it stimulates the window for iodines to get into the lumini, together generate thyroid hormone, where with the window process it comes back to the bloodstream as T3 and T4. This is receptor stimulating thyroglobulin, also stimulating iodine to get into the lumini. Thyroglobulin plus iodine gives rise to thyroid hormone, gets into the bloodstream in the form of T3 and T4. That's what the thyroid gland secretes, T3 and T4. T3 as triiodothyronine and T4 as tetraiodothyronine or thyroxine. In hyperthyroidism, we will see the high T3 and T4 levels. Now, hyperthyroidism has two categories. One is primary hyperthyroidism and secondary hyperthyroidism. Now, in primary hyperthyroidism, autoimmune disease can be a cause of hyperthyroidism, where a genetic component exposes to the external component, develops the autoimmune response, but due to the genetic susceptibility, the antibodies acting against the tissue or attacking the tissue will lead to the autoimmune disease. That's the reason why where our own antibodies acting against the thyroid gland will leads to the increased T3 or T4 level, which indicates the hyperthyroidism. Now, the second example for primary hyperthyroidism is toxic adenoma or toxic multinodular goiter, where this is a follicular cell, this is receptor, which receives TSH, it stimulates thyroglobulin as well as iodine and raise to thyroid hormone to the bloodstream as T3 and T4. This is a normal process. But whereas in toxic adenoma or toxic multinodular goiter, without thyroid stimulating hormone, the receptor or a thyroid receptors get muted and it stimulates thyroglobulin as well as iodine, which gives rise to the thyroid hormone formation that leads to the increased T3 and T4, which is hyperthyroidism. Next is excessive iodine levels, where this is a follicular cell. This is our thyroid receptor, which stimulates thyroglobulin as well as iodine and gives rise to thyroid hormone formation, which again back to the blood in the form of T3 and T4. This is a normal process. But where in the blood, if excessive iodine or excessive iodine secretion will raise the stimulation of thyroglobulin with the rise of iodine leads to the thyroid hormone secretion high, that raises the T3 and increases the T4 levels, which again is an indication of hyperthyroidism. So these are the few examples of primary hyperthyroidism. Now let's see the secondary hyperthyroidism. In secondary hyperthyroidism, where pituitary adenoma can be a cause of secondary hyperthyroidism, because as we know that hypothalamus secretes thyrotropin hormone and pituitary secretes thyroid stimulating hormone and thyroid gland secretes T3 and T4. Due to any reason where the pituitary gland has a adenoma, which increases the secretion of thyroid stimulating hormone, which affects the secretion of T3 and T4 levels to raise, can lead to hyperthyroidism. In secondary hyperthyroidism, next is molar pregnancy or choriocarcinoma. In molar pregnancy or choriocarcinoma, where during the gestation we know that we check beta human chorionic gonadotropin levels, that we call as beta HCG levels. Due to any reason, if there is a lot of production of beta HCG, which not only stimulates the uterus but it also stimulates the thyroid receptor as TSH or thyroid stimulating hormone, which leads to the increase of or increase the secretion of thyroid hormone, that is T3 and T4, again is an indication of hyperthyroidism. The next secondary hyperthyroidism cause is stroma ovary, where in stroma ovary a ovary formed with tumor. This tumor is producing a tissue, thyroid gland tissue, which can produce thyroid hormone, can lead to the increase of T3 and T4, which again can be a cause of hyperthyroidism. We have seen the categories of hyperthyroidism, which are primary hyperthyroidism and secondary hyperthyroidism. We will meet in our next video program with few more information related to hyperthyroidism. Thank you.